You're watching and listening to The Daily Living Show with D. Elias.
Thank you for joining me. Today on Daily Living, I have Dr. V with me. Thank you very much, Dr. V, for tuning in. And she is joining our panel of experts. And the first discussion we're going to have is H-pylori. And it's a chronic bacterial infection that affects many Americans. And so, Dr. V, tell us a little bit, maybe start with the symptoms of H-pylori.
Yeah, so definitely. Thanks for having me on. And I think this is going to be a really great discussion today. There are so many people who will have H. pylori who go undiagnosed for many, many years.
Yes.
Thinking that they may have, just acid reflux, or wondering why they keep getting peptic ulcers or duodenal ulcers, ulcers in their gut. Other symptoms that can happen from H. pylori that many times can go undiagnosed for many years would be things like bloating in the stomach, especially after meals, or having issues sleeping, and anxiety, believe it or not, is an underlying cause of or rather the underlying cause of anxiety. We have found it, many times that it's actually been a combination of different infections, and H. pylori can definitely be one of those underlying causes.
Right. What we had discussed this earlier. A lot of people that go to the doctor and they are diagnosed with H. pylori are prescribed antibiotics, and the antibiotics tend to make it worse.
Yes. Well, you know what? Antibiotics definitely, can save lives. But most people are aware now that, ever since the 70s, antibiotics have just been overused. And what we've seen happen over the course of the last, 40, 50 years is that people have become very resistant to antibiotics. In fact, in many different instances of, many different types of infections, once antibiotics are given, it will actually precipitate a recurrence of the infection. So some really good documented scientific examples of that would be ear infections in children. Once an antibiotic is given for an ear infection in a child, it just precipitates more ear infections. And we see that the same is with H. pylori infections as well. So once a person is diagnosed with H. pylori, if they're fortunate enough that their doctor does think to test them for that, and if in fact they do have H. pylori, the typical standard of treatment for H. pylori is an antibiotic. But unfortunately, what we'll see is that once the antibiotic is given, it not only precipitates a recurrence of a raging H. pylori infection, so it comes back and it's even worse than it was before, but it can also create faster occurrences and creation of ulcers, and it can allow or create the stage for a series of multiple different types of infections in the gut that can lead to issues like SIBO, which is small intestinal bacterial overgrowth, or other different types of infections in the gut. And so giving an antibiotic for H. pylori many times proves to be unsuccessful. Fortunately, we can use many different types of botanicals to help eliminate the infections and then to reestablish the healthy microbiome or ecosystem of the gut so that the infections don't come back.
Right. So which herbal botanicals would you recommend?
So there are a combination of different botanicals that we like to use whenever we are working with a patient who is struggling with H. pylori. And one of the things, let's back up just a little bit and let's talk about, how H. pylori can happen in the gut.
Right.
Most bacteria are killed, like bad bacteria. We call those pathogenic bacteria. If they don't belong in our bodies, then, we'll just call those pathogenic or bad bacteria. One of our first lines of defense for our immune system is in our stomach. And our stomach, you see, it's very acidic. It's extremely acidic, in fact, and it's supposed to be that way. And whenever we lose the acidity of our stomach, either because we're not producing enough acid or because we're taking antacids, then that allows for the introduction and the setup of pathogenic or bad bacteria. One of those bacteria are H-pylori. You see, when the stomach is acidic, it will kill a lot of these pathogenic or bad bacteria. But H-pylori is one that can very easily set up house in our stomach and our GI tract when we're taking antacids. And a lot of people don't realize that when they're having heartburn or acid reflux, it's not actually because there's high acidity, it's because there's not enough acidity. So it sounds super counterintuitive, right? But people will start struggling with heartburn or acid reflux, and they'll start taking over-the-counter antacids. And then when that doesn't work, they'll go see their doctor, and their doctor will put them on an antacid, which we've recently seen, that a lot of them have been pulled off the market. As as holistic doctors and functional doctors, we've been getting people off of antacids for the last 10-15 years, because we know what the negative effects are on the body. And so but that's kind of a little bit of an introduction to how it can even happen in the first place. So once we have the infection and we've identified the H. pylori infection, what do we do first? So one of the first things that we want to do is we want to start recreating the acidic environment of the stomach. And we can do that, by taking, certain, certain different botanicals and such. But let's talk for a few minutes about some of the things that we use to get rid of the infection. So Mastic Gum, Mastic Gum is very, very effective at helping to reduce H. pylori colonies. Mastic Gum is it's a resin obtained from a particular tree, and it's actually used very commonly in the Mediterranean area of the world. And typically we like to dose Mastic Gum at about 1,000 milligrams 3 times a day whenever we're treating somebody or working with an H. pylori infection. But we like to combine the Mastic Gum with licorice root and marshmallow root and slippery elm bark. That combination of botanicals works very, very well. So licorice, it's been used in Chinese traditional medicine for hundreds and hundreds of years. To support several different functions in the body, but it's really, really good for supporting the gastrointestinal system. And it can be used to soothe and coat the inside of the stomach and the throat as well. And the marshmallow and the slippery elm bark have also been used traditionally to help with, with GI issues. And a really good supplement that we like to use whenever we are working with our clients is it's a product by Douglas Labs, and it's called Hpylori Plex. And we like that because it has a very high dose of the Mastic Gum combined with the licorice, marshmallow root, and slippery elm bark.
Okay, so you get one capsule that has all the ingredients that's needed.
Yeah, that just makes it so much easier, because otherwise you've got 3 pills or 4 pills right there that you're taking. So if you can find something that is designed specifically, for working, to reduce the H. pylori bacteria, and you can find, a product that already has everything together, it just makes it so much easier. Bile acids are another one. So, bile acids and enzymes will help stimulate the secretion of bile acid and the flow of bile acid. And that's really important, because as we start to have die-off, meaning as we start killing off the infection, using different botanicals, we want to make sure that we're able to flush that out of our system.
Right.
And so, typically when people are having H. pylori issue, it has caused a cascade of other issues with their entire digestive system. And so we want to make sure that we add, some, different like bile salts combined with enzymes like protease, lipase, amylase, things like that. Taurine and curcumin are also really, really good. Milk thistle, all of those things combined are wonderful for helping to create more of the bile salts that we need, so that we can, eliminate these toxins out of the body. As we start killing off H. pylori, and this is common with a lot of different types of infections that we work on with clients. You start killing off these different types of bacteria or parasites or whatever it is that's in your GI system, they produce what is called endotoxins. And endotoxins can be very, very inflammatory to the body, and they can also affect the nervous system as well. And so we really want to make sure that we are adding, binders and bile salts and things to help flush these things out of the body. So Digestion GB by Pure Encapsulations is something that we really like to use that combines bile salts along with different enzymes. And then we have binding agents. So the binding agents help with eliminating the biofilms and the endotoxins, or again, as you're killing off any type of infection, you want to make sure that you have binding agents, so that the binding agents will bind on to the endotoxins, right, and bind on to the other toxins that you're trying to eliminate out of the body, to get them out of the body. And so, examples would be activated charcoal, humic and fulvic acid work really well for that. And then, apple pectin, GI Detox by Biobotanical Research, really great product that combines a lot of those ingredients. And so we like to use that as well.
Right.
And then finally, L-glutamine is really, really good. We like to use a high dose of L-glutamine to help reestablish the lining of the gut and heal those ulcers really, really quick, right? Because think about it. If you have an open sore, it's going to be, it can easily get infected.
Right.
And so we want to make sure that the H. pylori isn't like hiding and creating biofilm and hiding inside of the open wound, hiding inside of the ulcer. And so we want to go in behind it, as we are, debriding the inside of the gut, so to speak, and getting rid of the infection. Then we want to make sure that we coat it. So that would be very similar to if you had an open wound here, and you can see that if there's like dirt in there and it's getting infected, it's a little bit pussy. What do you want to do? You want to debride it. You want to put some peroxide on there and some things to just like really kill the bacteria. And then what do? Then you coat it with like a Neosporin or something, right, to coat it so that it can heal. So the L-glutamine is going to come in behind, and it's going to act kind of like the Neosporin, and it's going to help coat the raw tissue that has been created because of the infection inside of the GI tract and the stomach. It's going to help coat it, and it's going to help to heal it. So like a really high dose of L-glutamine combined with like licorice fruit and aloe vera, that's really, really wonderful to help heal the lining of the gut. And we like to use, there are many different ones that we like to use, but Glutamed by Numetica is really great because it has a super high dose of L-glutamine in it, and then it's got those other ingredients in there. So that's an example of like a typical protocol that we would use to help eliminate H. pylori. We also like to add biocidin in there, which is a wonderful antimicrobial, and that's by Biobotanical Research also. And then what we'll do is we'll put the client on this protocol, and we'll typically recheck them in 6 to 8 weeks. And we typically find that we can eliminate the infection inside of 6 to 8 weeks.
Wow.
Yeah. And have the ulcers healed as well.
Right. Does stress and anxiety play a role in H. pylori?
Sure it does. In fact, stress and anxiety was once thought to be the main culprit of H.
Yeah.
pylori.
Yeah.
So, you know, typically there's a combination of different things that cause people to become ill. It's the body is so resilient, and it has a lot of systems, and then it's got backup systems, it's got backup engines, backup generators, so to speak. So if one thing goes offline, if one engine, or if one systemic engine goes offline, the body has backup systems that it can use to help the body so that it can just keep on going. But it's typically whenever we have multiple different things going on that the body's systemic engines and the backup engines start failing, so to speak. And that's when people really start to exhibit symptoms and start to end up getting sick. So, if you combine a lot of stress and a lot of anxiety, and you're not eating right, and you're having wine every night, right? Or some kind, a little bit just to calm yourself down, right? So you're
Right.
self-medicating, and then you're not sleeping well, and then you're waking up in the morning and you're having coffee and skipping breakfast, and you're just, so a combination of all of those things can really allow the body to become vulnerable to getting an infection. And then on top of that, because you're having anxiety, now you feel like you're having heartburn. So you're taking the what? You're taking
Right.
the antacids or the Prilosec or the Tums, and what you're doing unknowingly is that you're creating a cascade of problems that are setting you up to get sick. And
Absolutely.
so, whenever we're working with our clients, first of all, we want to understand, what's your lifestyle? What are you doing every day? What's your mindset? Is your stress, is it exogenous stress? Is it because you're working with somebody at work that you just can't stand? Is it because you hate your job?
Yeah.
Or is the stress internal? Like, is your job good and your home life is good, but you're having some sort of internal stress and you're not sure where it's coming from, that anxiety?
Right.
Then we need to look a little further. Are your hormones balanced? Is it an infection like H. pylori causing the change in your brain chemistry? Where is it coming from? So it's really important to look at the whole picture, right? So that we can understand, where's the anxiety coming from? And if it's an exogenous or external factor that's causing it, what can we do to eliminate that? Because
Right.
you know what I'm saying? And if it's not an external factor and it's coming from the inside, well, what's causing it?
Right. Is there certain foods, if you are treating H. pylori, is there certain foods that you should avoid?
Absolutely. So whenever we're working on anything that's gut related, we typically put people on what we call a gut healing or an anti-inflammatory type diet. So to keep it simple, we typically want to stay off of gluten, gluten, dairy, sugars. We want to stay off of caffeine. We want to go ahead and stay off of nightshades, and we want to stay off of nuts. And that's just for the time that we're healing the gut, right? So for those 6 to 8 weeks, those are that's the top list of offenders that's not going to allow the gut to properly heal. So we want to stay away from those. And some people will say, oh my God, if I got to stay away from, gluten and dairy, what am I going to eat? Because a lot of us have grown up eating, our primary foods, right,
Right.
are starches that have gluten in them, and dairy and everything. We're having it in our coffee, we're having it in cheese, but there are so many different alternatives now. It's not like it was 10 years ago. I can understand that it would make some of our clients cry when we would tell them, well, we need you to get off of all this stuff. But there are so many other options these days, that you can make a paleo friendly, or a gut healing friendly pancake, for example, if that's what you want to make, that's not loaded down with carbs, that doesn't have a ton of sugar, and that doesn't have sugar in it, and that doesn't have gluten in it, because you can use like almond flour, for example. You know
Right.
what I'm saying? And so and there are even like syrups now that are made with monk fruit, instead of cane sugar, that taste absolutely fantastic. So there are a lot of alternative, flours, and a lot of alternative different things that we can do now, but we definitely have to change our diet around a little bit in order to heal the gut.
Does H. pylori, can you heal it, or does it just go dormant?
No, the infection can be eliminated. And
Okay.
we do with our clients, we will do testing to determine if the H. pylori has been eliminated or not. And there are different kinds of tests that you can do. So there's like GI mapping that you can do to identify H. pylori. You can also do the H. pylori breath test. What we have found is that oftentimes if there is an H. pylori infection, there are usually other infections going on as well. So we like to do more than just the H. pylori breath test whenever we're working with our clients to make sure that if we're going to go, that if we're going to, identify an infection, let's make sure that we've identified all of them and let's get rid of all of them at the same time.
Right. So if someone thinks that they want to know for sure, they can contact you. What steps would you take to find out if they do have H. pylori or some other type of infection?
So whenever we get on our first appointment with any of our clients, we spend a lot of time getting a very thorough history. We want to know, what are you eating? What medications have you been taking? Have you been taking antacids? What symptoms are you having? How long have you had them? Are they getting worse? And then that helps us to determine what combination of different labs that we want to do. So we are very, very data driven. Everything that we do is lab based. We always tell everybody the data doesn't lie. So, if we take a look at it and we identify, for example, an H. pylori infection, and we start working with the client to eliminate it, we're going to retest them after 6 to 8 weeks to make sure that we've eliminated it, or that at least we've made, some big progress there, right? Sometimes, just like with a medication, sometimes we have to switch and go to something different, or sometimes we need to increase the dose. We will use our follow-up visits and our lab testing to determine what progress that we're making with people. But the H. pylori breath test is great to identify, obviously, H. pylori, but GI mapping is really, really good. Organic acids testing can be really great to identify other co-infections. And that's typically where we will start. And then we can even look at the organic acids test, the GI map test, and even some comprehensive blood labs so that we can understand what nutritional deficiencies or malabsorption issues that the person is having secondary to the H. pylori and other infections that they may have. Because if they are now having, absorption issues secondary to these infections, they're going to start exhibiting other symptoms. Right? So they may start having issues with their sleep, or they may start showing a lot of fatigue, right? That's another symptom that you can have with H. pylori and other infections, because it's not allowing you to uptake the ingredients that you need that you'll typically get from your foods. Remember, our foods is like the gas for the car.
Right.
We got to put we have to put the right fuel in so that our body has everything it needs.
Mm-hmm.
Our body is self-healing. If the body has what it needs, the body can heal itself. And if we remove what the interferences are, the body can heal itself.
Right.
So we need to remove whatever the interferences are. So we need to identify those. Are they infections, heavy metals? Is it environmental toxins like glyphosate or pesticides, which we can do all that type of testing. So we will remove what the interferences are, and then we give the body what it needs, and we understand how to use botanicals and herbals and in what doses to use them so that they are actually effective to actually, make a difference in whatever we're trying to do. And, we see incredible results with people.
Right. I think it's fascinating listening to you. A lot of people perhaps have H. pylori and don't even realize it because of the heartburn, the acid reflux, and they're masking it by taking over-the-counter or even prescription medications for it, when if they are suffering from heartburn or acid reflux or whatever, they need to first find out what's causing that.
That's absolutely true. If you have a symptom, the worst thing that you can do is to take a medication to cover it up.
Right.
And that is how our Western medical model works. So, our Western medical model is fantastic when it comes to a reactive type of medicine. In other words, if you and I go skiing and I run into a tree and break my ribs and my shoulder, break my clavicle or whatever, like definitely take me down the mountain, take me, straight to the
Right.
hospital, because they're going to save my life. They're going to reset the bones and they're going to make sure that I'm okay. And if I lacerated my liver, they're going to stop the bleeding and they're going to save my life. Thank God for that. We're so lucky that we live in this country and that we have that. But where we've missed the mark is in finding the root causes of our symptoms.
Absolutely.
So what ends up happening is that our model has ended up in a place where when we have symptoms and we go to see our doctor gives us a pharmaceutical to cover up the symptom. They're not digging deeper to find what the root cause is, and they're not knowing how to use more effective substances like botanicals and herbals to actually heal the body, because
Right.
the pharmaceuticals are not designed to heal the body. The pharmaceuticals are designed to get rid of symptoms. But what happens? We all know that once you take a pharmaceutical, you're going to end up with 2, 3, or 4 symptoms from the very
Right.
pharmaceutical medicine that you were prescribed.
Yes.
And then what happens? Then you have to end up taking 2 or 3 more medications to cover up the symptoms for that medication.
Absolutely.
And then the next thing you know, you're on 15 different medications and you're sicker than you've ever been. And so
Absolutely.
that's where, for all of your listeners out there, it's so important to realize if you have a symptom, that's your body's warning check engine light. It's trying
Yes.
to tell you there's something wrong here. We need to figure out what's causing it, so that once we eliminate what's causing it, the symptom will go away.
Right. That's absolutely right. Okay. So much good information. I always thought that it just went dormant, so I'm proud you said that. So it is curable. You can heal the gut of H. pylori.
Oh, absolutely. Absolutely, you can. And you can see it on lab testing. H. pylori is no different than any other type of infection. You can eliminate just about every infection there is. There are a few out there that can be very difficult and it's questionable. But H. pylori, it's just, it's a bacterial infection that's not difficult to get rid of.
Right. That's awesome. Okay, Dr. V, thank you so much. There's so much good information on H. pylori, so I'm very proud that we had this discussion on this topic today. Next week, our discussion is going to be flu symptoms. Flu season is coming on, and I think that's important that everyone should know what's the best and to keep up our immunity. So thank you very much for tuning in, and thank you, Dr. V.
Oh, thank you so much. We'll talk to you soon.
Okay.
Please support our sponsor, renovationtea.com. You'll find a large variety from daily to specific herbal remedy teas, all certified organic and fair trade. Use DL10 to get a 10% discount. You can find details in the description below. If you like what I'm doing, please like and subscribe, and don't forget to hit the notification bell so you won't miss an episode.